to call the meeting to order. I think it's 2:01. And I do have a public comment to read. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, the request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss or negotiate claims at this meeting. And so I would like to say, I note that Mr. Henry is appearing by phone and Ms. Reiner is not attending today, each having been excused by myself, the chair, for health reasons. Also, as the pandemic remains unstable, you see that we are seated to accommodate state and federal recommendations regarding social distancing. We are also continuing to streamline our meeting process to avoid non-essential items from our consideration. And now, next on the agenda, I'd like the approval of the orders of the day. Do I have a motion?
Second.
I have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. I'd also like to approve the minutes of the meeting of December 20th, 2021. Do I have a motion?
Second.
I have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Now we have board reports. And there are no board reports, so we will move on to the medical staff reports. And I have joint reports of the Sarasota Memorial Hospital, Sarasota, and Venice medical staffs. Dr. Fiorica, Sarasota Memorial Healthcare System Chief Medical Officer.
I have nothing to report.
Thank you for that, Doctor. Next, I have Sarasota Memorial Hospital, Sarasota, Dr. Richard Lichtenstein, Chief of Staff, with the recommendation to approve SMH-Sarasota policies, guidelines, procedures, and forms.
Thank you, Madam Chairwoman. At this time, I would ask for a motion approving the Sarasota Memorial Hospital, Sarasota campus, chest pain protocol, watchman criteria, and admission guidelines by specialty, all as recommended by the SMH-Sarasota Medical Executive Committee.
Second.
We have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Next, Sarasota Memorial Hospital, Venice, with Dr. Chris Jefferson, Chief of Staff, with the recommendation to approve Venice policies from SMH with guidelines, procedures, and forms.
Thank you very much. I would ask for a motion approving Sarasota Memorial Hospital, Venice, ophthalmology privileges and EMTALA on-call policy, both as recommended by the SMH Venice Medical Executive Committee.
Second.
I have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Thank you for that report. Next, we have the Secretary's report with Greg Carter as Secretary, please.
Thank you, Madam Chair. On Thursday, February 22nd, our next board meeting, we will have Mission and Planning Committee at 9. We did have an investment committee at 10:30. At noon will be the closed session of the hospital board meeting. At 12:30 will be the board board lunch and the issue and financial review. And at 2 o'clock in the afternoon will be the board meeting. And that concludes our report.
Thank you for that, Mr. Carter. Next, we have the treasurer's report. Joseph Julio Jr.
Thank you, Madam Chairwoman. I have one item today, and that's approval of the bad debt and charity care. I move approval of the bad debt and charity care for the month ending December 31st, 2021 in the amount of $16,325,000.
We have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Next on the agenda is our financial highlights with William Wojin, our Chief Financial Officer.
Thank you, Madam Chairwoman. The financial highlights for December, we'll start with total revenue for the system. And for December, we had revenue of $122,595,000 compared to a budget of $110,824,000. Fiscal year to date, and this is through our first fiscal quarter, so 3 months of activity, total revenue of $344,414,000 compared to a budget of $316,279,000. For the total expenses for the system, in December, $116,313,000 compared to a budget of $106,170,000. Fiscal year to date, total expenses of $325,869,000 compared to a budget of $303,265,000. The operating income for the system, and this is in the rating agency format, for December, $6,282,000 compared to a budget of $4,654,000. We had an actual operating margin of 5.1% compared to the budgeted operating margin of 4.2%. Fiscal year to date, again, this is 3 months, operating income of $18,545,000, which is an operating margin of 5.4%, compared to the budget of $13,000,000. We budgeted through 3 months an operating margin of 4.1%. Moving to statistics for the hospitals, and these are combined, Venice campus and Sarasota campus. Average daily occupancy, 681, compared to a budget of 646. The Sarasota campus had an actual average acute length of stay of 4.79. Last year it was 4.75 days. And Venice had actual length of stay of average length of stay of 3.79 days. Admissions through 3 months, 11,417 for the two campuses combined, compared to a budget of 11,868. Continuing statistics in surgery cases, a total of through 3 months, 6,445, compared to a budget of 6,610. Births, we had 1,094, with a budget of 1,092. For outpatient registrations, again through 3 months, 130,062 compared to a budget of 128,767. And in our emergency care centers, total registrations 33,737 compared to a budget of 33,241. And case mix index for the Sarasota campus, all patients 1.96, and for the Venice campus 1.37, and for Medicare patients at Sarasota campus 2.05, and at Venice campus 1.37. Madam Chair, that concludes my report.
Thank you for that report, Mr. Wojin. Next, we have our committee reports. There's the Joint Finance and Audit Committees with the chairperson of Sarah Lodge. Please begin, Sarah.
Thank you. This morning, the Audit and Finance Committees met in joint session. The minutes of the December 20th, 2021 Finance Committee were approved. The minutes of the September 20th, 2021 Audit Committee were approved. Todd Webster, CPA of KPMG, presented the draft results of the audit of the fiscal year 2021 financial statements of the district. He stated that the audit went well and reported the auditor's required communication, including significant audit areas, management judgments, and estimates used in preparation of financial statements. At this time, I move acceptance of the fiscal year 2021 SMH-CS Consolidated Audit Financial Statements as recommended by both the Audit and Financial Committees.
Second.
We have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Continue.
Thank you. Maureen Pingree, CPA of Walters and Associates, presented the draft results of the audit of the fiscal year 2021 financial statements of the SMH Healthcare Retirement Plan. She stated that the audit went well and reported the auditor's required communications. Ms. Pingree reported that the plan is very well funded at approximately 106%. At this time, I move acceptance of the fiscal year 2021 audited financial statements of the SMH Healthcare Retirement Plan as recommended by both the Audit and Finance Committees.
We have a motion and a second. All those in favor, please say yes.
Yes.
Any opposed? Hearing none, motion passes. Continue, Sarah.
Great. Todd Ness, Director of Audit Services, provided an update on internal audit projects. Part of the presentation was given by John Critelli of Protivity LLC, relating to the audit procedures performed by Protivity on the construction invoices for the Cancer Institute and the SMH Venice projects. No motion necessary. This is for information only.
Okay, thank you for that report, Sarah. Next on the agenda is our, one more?
Yes.
Oh.
Sorry. So, Bill Wojan, CFO, presented a request for approval of a resolution authorizing Robert Pittett to be authorized party for transactions in the district's board designated funds investment accounts held by Northern Trust. This will enable a smooth transition upon Nelson Lane's retirement to allow for the proper functioning of day-to-day investment activities and transferring of funds between accounts as needed. At this time, I'll ask Carol Ann to read the resolution, and then we will ask for a motion adopting the resolution as recommended by the Audit and Finance Committee.
Thanks, Sarah. So this is a resolution reflected entitled Northern Trust Investments, Inc. Authorized Parties. The client entity name is Sarasota County Public Hospital District Board Designated Funds. And the matrix set forth herein on the resolution below contains the authorized persons and their corresponding titles from which Northern may accept written direction with regard to all accounts maintained by Northern as of the date of execution of this authorized parties form, as well as any and all accounts opened and maintained after such execution date for the above named client entity. And the names are David Verinder as President and CEO, William Wolchin as CFO, and Robert Pettit as Controller. Northern shall be fully protected in acting upon any written direction believed to be genuine and signed by any of the above designated persons, and that would be resolved as of this date and signed by Greg Carter if you have a motion accepting the resolution as published.
Okay.
Did you make? Okay.
Do we have a
Sorry.
motion?
Yes, we'll make the motion adopting the resolution as recommended by the Audit and Finance Committees.
Second.
We have a motion and a second. All those in favor, please say yes.
Yes.
Any opposed? Hearing none, motion passes.
Thank you. This concludes my report.
Thank you, Sarah. Next on our agenda, we have Quality Committee by Dr. Richard Graymeyer, Chair of the committee.
The Quality Committee meets,
Microphone, please. Thank you.
the Quality Committee meets in confidential closed session, so there is no report. However, we would like to welcome Cheryl Roberts as our interim Director of Quality. following the retirement of Dr. Mary Carey. So we would like to welcome Cheryl, and we wish Dr. Gary well.
And thank you for that, and we do welcome Cheryl. Next, we have the Governance Effectiveness Committee with Joseph DiVirgilio, Chair.
Thank you, Madam Chair. This morning, the Governance Effectiveness Committee met to appoint a community representative to the Finance Committee. Sadly, we had to undertake this process because of the death of a longtime valuable community representative, Frank Flesher. Frank was an asset to the committee and to the community, and he will be sorely missed. We were grateful, however, that we had several extremely qualified candidates respond, expressing interest in serving. After discussion during which the committee agreed that we were lucky to have such good candidates, the committee selected a representative. At this time, and in accordance with the board bylaws, Article 4, Section 5 and 7, and the board policy on community representatives, I move approval of the appointment of John Patterson. I knew I was going to do that. Thank you. John Patterson as a community representative on the Finance Committee for an initial term to expire on September 30th, 2023.
Do we have a second? We have a motion and a second. All those in favor, please say yes.
Yes.
Any opposed? Hearing none, motion passes. Next, we have our President's Report with David Berenger, our President and CEO. Welcome, David.
Thanks, Madam Chair. I'm going to start, like I do each month, looking at our organizational report card. As you're all familiar with this, we look at our fiscal year to date, 2022 through December on this, which would be our first quarter ending. We look at 5 different areas: service, people, quality, finance, and growth. And we're going to look at our goal and then ultimately our score and how we're doing on that. So the first one is in the service category. We have a goal of having 8 out of 10 of our departments that we look at being greater than or equal to the 75th percentile in terms of likelihood of recommending. Happy to report that we are meeting our goal at 8 out of 10 of those, and I'll show you the details on that here in a minute. In the people category, we have our new hire retention, which is our percentage of regular, full, and part-time employees that have been hired in fiscal year 2022 that are still employed by the end of this fiscal year, which is September 30th, 2022. We have a goal of having 83% of those maintain their status. Right now, we are at 93.37%. In the quality section, we have our goal is to have our combined overall standardized inspection rate being less than 0.85. I'm happy to report we're beating that at 0.75. Just to remind the board and the community that 1.0 would be the expected for the national average, so we're quite a bit lower than both of those. In the finance section, we already heard from our CFO, Bill Wojcik, on the operating margin. Our goal is to make a 5.5% operating margin, and we are trending just north of that at 5.8%. And then finally, in the growth section, we have 2 goals. The first being our inpatient admissions and observation outpatients being at 60,119. Our run rate is exceeding that at this point at 62,234. And outpatient registrations having a goal of 1,125,000, and we are having a run rate that's exceeding that as well at 1.130 million. In a patient experience report card, so the detail on what we were just showing, I'll orient you onto the grid. The left is the likelihood of recommending, and it shows our 10 different areas that we survey. The middle is what our actual score is. The next one over is the national median score. And then finally, what we compare ourselves to is the 75th percentile score. As you can tell, that in 8 out of 10 of these, we have exceeded the 75th percentile. In all 10, we've exceeded the national median. And then the 2 that are just 1 point off each are ambulatory surgery at 88 versus the 89, and first physicians group, which is at 93 versus the 94. Next, I'd like to remember a friend to us all. We did have to say goodbye to Sarasota County Public Hospital Board member and our friend Tom Towler, who recently passed away. Following a successful career in business, serving as a CEO for numerous companies, including Peyton's, which was Kroger, and Top Value Enterprises, he retired to Sarasota in 1982. Committed to his new community, he began volunteering at SMH, transporting patients and eventually becoming an elected hospital board member. I'll also say he served as a trustee on the Hospital Foundation Board as well. He also served on numerous nonprofit boards and was involved in fundraising efforts, including SMH's Foundation. Tom was a personal friend of mine, somebody I got to know over the last 16 years of being here, and we will all miss him. SMH experts provide COVID-19 update. Throughout the pandemic, Sarasota Memorial's physicians have provided key information to the community. This month, infectious disease specialist Manuel Cordelio and critical care pulmonologist and our associate chief medical officer, Dr. Joseph Seaman, offered vital updates via video about the recent surge, antibody treatments, testing, and the importance of booster shots. We will thank them both for being here. Lending a hand during the surge, many thanks to staff who have joined the Helping Hands labor pool. These employees work outside and in their normal scope of work to support the demands of the latest COVID surge. The labor pool helps clinical and non-clinical areas. Assignments are based on skill set, include assisting with COVID testing and other services at urgent care centers, screening and following up with staff through the Employee Health COVID hotline, helping food and nutrition with meal prep and delivery, and much, much more. So we want to really thank our people for stepping up and serving in additional capacities. SMH employees spread holiday cheer. The staff at Sarasota Memorial continue their tradition of giving during this holiday season. Photos below represent just a few of the departments who joined the forces to support families in our community. And we thank you for making this time of year extra special for those that were in need. SMH-Sarasota welcomes the first baby of 2022. Congratulations to the parents, Lauren and Patrick, who greeted baby boy Bo at 1:36 a.m. on January 1st, 2022. The mother baby nursing team presented the family with a special New Year's baby basket filled with gifts for the baby. A total of 18 babies were born on December 31st, 2021, the last day of the year. The last baby of the year was born at 11:27 p.m. and capped off the largest year ever for Sarasota Memorial's delivery at 4,275 babies, including 69 sets of twins and 1 set of triplets. Madam Chair, that is my report. I'm happy to answer any questions.
Do we have any questions for Mr. Verinder? No? Thank you very much, David, for that report. Next on the agenda is the consent agenda, and there is nothing to report on that consent agenda. And so moving on, we do have our public comments, and we have Martin Hyde, who will speak to us for his 5 minutes. Please come down.
Okay, not my first rodeo. My name is Martin Hyde. I'm one of hundreds of thousands of local taxpayers who subsidise this facility, which was simply called Sarasota Hospital when it was first opened in 1925, at which time it had about 30 beds, and it housed partly in canvas tents. In 1927, it was renamed Sarasota Municipal Hospital when it was handed over to the city of Sarasota. And by the 1930s, had around 100 beds, an ambulance station, a nurse's residence, and a patient overflow wing. In 1954, it changed its name to its current one, Sarasota Memorial Hospital, to honour those who died for our country in World Wars I and II. In 2022, Sarasota Memorial Hospital System has over 800 beds, close to 8,000 employees, and our annual revenues, as we just heard, well north of $1 billion. Sarasota Memorial, has a CEO whose salary is well over $1 million a year, with the security of a 10-year contract approved by this board. The elected board of Sarasota Memorial Hospital holds these monthly public meetings as required by statute. Now, we've heard that these meetings are abbreviated to save for COVID. I'd make the point that this is a time when we should have more public access, not less. One point I would make, we're so bothered about COVID, you're handing microphones around like COVID sticks. Masks ain't going to help you if you ain't got gloves on, so just a thought. Anyway, the total length of these meetings for the whole of 2021 that was publicly broadcast was 393 minutes, which is an average of just under 33 minutes of public viewing per month. Now, this would indicate that either you are extraordinarily efficient and able to discuss $100 million of monthly revenue and public policy in just over half an hour a month, or that 30 minutes a month is plenty of time to blindly rubber stamp what is being done with our tax dollars without question. So I brought a few questions for you. These are questions that I'd like to see answered publicly at some point during these meetings. They include the following. How many patients are admitted for COVID as opposed to with COVID on a daily basis? Why has the hospital changed the way it reports COVID cases to include people who had it but no longer have it but remain hospitalized for other reasons? Why does the hospital only count as vaccinated those who present with their physical vaccine cards on their person and count all others as unvaccinated, even if they might actually be vaccinated? Why does the hospital code those patients who test negative for COVID as having been exposed to those with COVID? Is it true, and I have proof that it is, that the employee helpline has been telling staff who test positive for COVID but are asymptomatic to report back to work within a few days without the requirement for a negative test? Is it true, and again, assume that I have evidence that it is, that some cardiac surgeons within this healthcare system are refusing to operate on unvaccinated patients? Can you confirm that patients at the Bayside Facility for Mental Health are not isolated from each other, regardless of their COVID status, which again, I can prove? Is it correct to assert that over 90% of ventilator use in the last month was for non-COVID patients? Where can the public find out how many patients died at the hospital in the last 22 months without COVID? Because we clearly know exactly how many allegedly died with it. Finally, what is the board's position on the staff who worked pre-vaccine, risking their own health, who choose now not to be vaccinated, which by definition remains a risk for them and not for patients, as being contagious is not stopped by vaccination? The answers to these 10 questions might take longer next month than 33 minutes, but you were all elected as representative of taxpayers, not as cheerleaders for unelected bureaucrats. Thank you for your time.
Thank you for your comment, Mr. Hyde. And now moving on to our agenda, we have legal matters with Carol Ann Kalish. Please, Carol Ann.
Thanks so much. As you know, the Governance Institute meeting that was scheduled to be held in Naples earlier this month was adjusted, and most of those who were registered attended virtually, and no expenses were incurred. I know that Mr. Hudson has expressed an interest in attending an alternative Governance Institute meeting, as has potentially other board members, and there is one that is going to be held in Georgia in March. Like the Naples meeting, it is expected that some of the expenses will be in excess of the limit for travel for public entities. However, consistent with the law and board policy regarding reimbursement of expenses, and in order to encourage attendance at appropriate educational conferences, the board can approve reasonable expenses for such travel. If the board so chooses, they can have a motion now approving the payment or reimbursement of reasonable travel expenses for the Governance Institute Conference in Georgia.
I'll second it.
We have a motion and a second. All those in favor say yes.
Yes.
Any opposed? Hearing none, motion passes. Thank you, Caroline. Next is other business for which we do not have anything that has come up. So we'll move on and we will call this meeting adjourned. Thank you all.